So growing up, I didn't have health care, and my parents were too proud to really go on Medicaid or any kind of government assistance like that. So I really didn't have health care, health insurance until my mother started working with the Bureau of Employment Services, and then I was actually had health care for the first time, probably about 13, 14 years old, and so prior to that, I didn't really have access to doctors. Now I went once in a while, but it had to be really, really bad. And I had to, it wasn't just a sniffle and medications. That was just not something that, was there. It was Advil or ibuprofen or aspirin or whatever. They gave us aspirin back in the day, as children. We had, baby aspirin, actually, but then in the 90s, I actually was licensed as a life and health insurance agent in the state of Ohio. I sold life policies as well as health insurance policies. And those health insurance policies, it was awesome because, I could sell health insurance policy to business owners. However, they still had to go through underwriting. They had to get and this is before HIPAA and all this stuff. And so they would, request the medical records of the person, and then they could rate them up or down based upon their experiences. And of course, deny them, especially if they had a pre-existing condition. They weren't a good risk. You weren't going to make money on somebody who was actually going to use healthcare. So oftentimes I'd write a policy and it would be denied by underwriting because the person had some sort of a history that didn't make them a good candidate or a good insurance risk. And remember, insurance is all about risk. So what I thought I would do is, being a business owner, I don't have employer-sponsored health insurance. So what I wanted to do was actually walk you through the ACA Healthcare.gov website. Now, keep in mind that, people talk about the ACA and whether it's good, Obamacare. There's been movements to try to get rid of it. The individual mandate was struck down, which did provide some sort of a financial penalty if you did not obtain health insurance, and you could, but chose not to. And of course, there are subsidies that are allowed in the ACA, which were renewed under the current president, President Biden. So what I wanted to do was actually take you through healthcare.gov instead of looking into what people think about it, and actually show you what it is and what kind of choices are available. There's a lot of information out there about lack of choice and about, doctors and, and insurance and what have you, and high deductibles and what have you. But that's all anecdotal experience. What I would like to do is show you exactly what it looks like. So I figure the best way to explain what Obamacare is, or the ACA, is to actually take you through what it looks like. Now, I'm a small business owner, so I'm not eligible for an employee healthcare benefits that are negotiated by an employer. So I have an option now to go to healthcare.gov and see what's available to me. There are some insurance companies that you can go straight through and they offer or market ACA compliant plans, but all of them are going to be offered here on healthcare.gov. So I'm going to go ahead and log in, and I am in the state of Florida, and I'm going to go finish my 2023 application. So there are 4 sections. You set up the application, enter in personal and household information, report current coverage and life changes, and submit your application. So if you were to lose your job or to start a new company for yourself, those would be considered life changes. There's some other life changes too that we'll talk about. So I'm going to continue to my application. So in my application, it says check for savings options to see if you're eligible. You can apply these savings to the plans you select. This is really dependent upon what your tax return was and how much money you made last year and how much money you anticipate on making in the next year. I personally continue without checking for savings options because if there are savings options that are available, I can reduce that off of my tax returns the next year, but I'll pay full price every month. So I won't actually realize any savings if I qualify for them until I do my taxes the next year. So we're going to say continue without checking for savings options because we want to know what the real cost of the insurance is. Click on continue. Here's my information. I was born January 10th, 1970, and I may redact some information depending upon what comes up. My home address, my mailing address, my email address, my second phone number, preferred language, contact. I want to see paper notices in the mail. Now, the reason I do this is because I don't want things going to spam, and I want to be able to actually see things. I actually enroll in paperless notices for like credit cards and my mortgage, but in this situation, anything that has to do with the government, whether it's the IRS, Secretary of State, or in this case, my healthcare coverage, I do want to have a paper copy mailed to me in the mail, but they also will send you notices electronically in email or text. As a matter of fact, when November 1st rolled around, which was the first opportunity to enroll for 2023, I did receive a text message as well as an email. And I will for the next probably 6 weeks, once a week, receive an email reminding me to do what we're doing here today. Is a professional helping you complete your application? You can actually call into a licensed health insurance broker to help you fill this application out. They do receive some sort of assistance from the government, some sort of a fee that they can charge that is reimbursed by the government for helping you, but it is no cost to you. At least I believe so. I'm going to have coverage for myself and my 2 children. So they live together, the home address. We are not incarcerated or Native American. We're not Latino or Hispanic. We're white. My kids are both white as well. My social security number, it is redacted. Does the name below match? Yes, it does. Same thing for my daughter, and same thing for my son. Is every person applying for coverage a U.S. citizen or U.S. national? The answer is yes. Now they're going to ask about different things. Healthcare reimbursement arrangements, as well as if I have qualifying healthcare coverage that I could choose through a job, through COBRA, through Medicare, Medicaid, or CHIP, or other type of qualifying health coverage. Now, I don't qualify for Medicare. I'm not of that age, so they don't even list it on here. Click on continue. Have any of these people been offered an individual coverage HRA provided to start date between blah, blah, blah? The answer is none of these people have received any kind of qualifying. My daughter does work. My son is still in high school, but she does not qualify for coverage through her job. So none of these people are going to lose or have lost coverage. They're not going to lose any qualifying coverage between now and the 5th of January. Nobody got married that I'm aware of. We did not gain a dependent. I did not move, and I was not in jail. So none of these changes occurred. Here's my contact information, my kids' contact information, and now it's going to say I agree the the marketplace to end the marketplace coverage of my situation. I don't give this. Okay. If anyone in the application is enrolled in a marketplace coverage and is later found to have a qualifying health coverage like Medicare, Medicaid, CHIP, the marketplace will automatically end their marketplace plan coverage. This will make sure that anyone who's found to have other qualifying coverage won't stay enrolled in marketplace coverage and have to pay full cost. So what they're doing with this is they're making sure that if you make $10,000 a year and that you apply for coverage, well, they're going to forward your information on to the state to make sure that if you qualify for Medicaid, then they're going to offer that to you because that's, of course, at no cost. That way you don't have to actually spend money on your health insurance. And I agree to allow them to do that by signing this application. And I'm going to type my name in, sign and submit. And the next part, it's going to come up to family and household and eligibility results. So it says I'm eligible to buy a marketplace plan. You have to view the eligibility notice, which then pops up in a PDF in Adobe Acrobat. And both of my kids, move this over so you can see this, says that I have applied for coverage, eligible to enroll in a marketplace plan until January 15th. That's when enrollment closes. And my kids are actually eligible to buy a catastrophic plan if available, and those will be a different thing, but I'm not going to want a catastrophic plan. I want to continue to enroll. Again, you can see it's at USA.gov. None. Save and continue. I don't want to search for doctors and facilities. And group 1 is complete goal. Let's see. Start with current groups, view plans to get the group started. To change groups, make the changes, then view plans for the new groups. Well, we are all grouped together. And we get the definitions, filter the plans by feature, and then select plans to compare. So the average premium for a bronze plan is $1,312 per month. Has lower monthly premiums. In silver, deductibles higher, and you pay more when you get care, all the way up to platinum, which has the highest monthly premium, but your deductible is very low, and your plans pays nearly all the cost of your care. So I'm going to look at all the plans, and we can sort these by lowest premium or lowest deductible. So the plan you pick, if it's this and better from Sunshine Health, it's complete gold. It's 20% coinsurance after deductible. So I have to spend $2,900 before my insurance kicks in. For generic drugs, it's $14. Primary care doc is a $15. Actually, this isn't too bad. Specialist is only $35. So, yeah, that's not too bad. And the total out of pocket for the family is $15,000. So if everything just turns terrible and major car accident, illness, whatever, the most I'm going to spend out of pocket is going to be $15,000 this year. But just want to give you an idea of what it looks like. You can also go to in here and sort by monthly premium. How much do you want to spend? Again, I have about 145 plans that are available for me to purchase. So as far as variability, variety, I do have quite a bit of variety of the types of plans I want to purchase. And I have 6 different insurances that I can choose through Healthcare.gov. Going into the choices a little bit deeper, I found this CMS Standard Expanded Bronze for $1,100 a month, high deductible, high out-of-pocket maximum, but covering generic drugs, doctor, and specialist with a 50% coinsurance rate. So look into the plan details. You can add your yearly cost for what you estimate it's going to be. Look at medical providers to see if they're in network. The star rating doesn't really give you a lot of information, but each one of these 140 or so plans that I have available to me have plan documents, a summary of benefits that's available. It's what's the overall deductible? Are there services that are covered? For example, like I said, children's eye exam and glasses, lab work, generic drugs are covered before you meet your deductible. Are there any other deductibles? No. Premiums balance, billing, This plan doesn't cover. Balance billing is where the hospital charges $10,000, they get reimbursed $5,000, and then they send you a bill for $5,000 because insurance only covered $5,000. So we want to make sure that as consumers of healthcare, that we're not going to places that have balance billing. There are 10 pages in this. What does this cover? What doesn't this cover? Going back to our plan, provider directory, list of covered drugs, the brochure, cost of medical care, tells you exactly what it is for outpatient services, prescription drug coverage for generic, brand name specialty drugs. Let's see, access to doctors and hospitals, hospital services, cost and coverage examples. I would almost warrant that this is more information than you receive from your employer-sponsored healthcare program. You know, you get a card and you have a general pamphlet of what's available, but really digging into the details is not something that you have available to you. But it is under the under the Affordable Care Act for plans that comply with this that are available on Healthcare.gov.